Tonight, the latest infectious disease, monkeypox, spreading across the country and causing concern about children being infected. New CDC numbers showing almost 3,500 cases in the United States, 268 of them right here in Georgia, and appointments to get that vaccine booking up within hours. Just hours after opening up those appointments, you're going to get this message right here if you try to book a slot on the DeKalb County Health Department's website. And we all know that you're really concerned about your family, so we're getting the answers you deserve from the top experts right here in Georgia. And they want parents to know that pediatric cases are expected to rise.
Yeah, but the risk to children is still pretty small, so you don't need to panic. John Sherrick on the story for us tonight from CDC headquarters in Atlanta. John, understandable that parents are worried about this, especially with school starting up now.
Right, children under 8 years old are considered among those at higher risk for serious infection. And yet, the message to parents tonight is be aware, but don't worry.
At a playground in Atlanta's Piedmont Park, parents watching their children and talking monkeypox, but not concerned.
Not to say we're ignorant to the fact that monkeypox is out here, but it hasn't really been put on our radar. Because of the demographic that we've been told that is really affecting, we're not really worried about it as far as our children go.
There have been at least 2 known pediatric monkeypox cases in the U.S. so far. But as cases overall continue to rise.
You know, it's very possible that cases in children are going to increase. You got to realize in these 2 cases, there was contact with a person who was at high risk, who had the infection, and that led to the infection in the children. But you can imagine those children then going to school or going to day camp or something like that. And that could then spread it to other individuals.
Dr. Carlos Del Rio of Emory University's Infectious Disease Division says as long as infected people isolate, have no contact with others, they will likely not spread it to children or anyone else. Researchers still investigating the best treatments for children who do get it. Dr. Del Rio says statistically in the U.S. right now,
I'll be more concerned about my kid being shot than my kids getting monkeypox.
The pediatric monkeypox cases, he believes, will continue to be statistically small.
A fluke, an exception, and we need to focus right now on really getting vaccines out to the most affected communities, getting information out, and hopefully try to stop this outbreak.
Now, public health doctors emphasize how crucial it is that people who start to develop symptoms, including the onset of a rash, get tested and isolate, and if they are positive, stay in isolation until they recover in 2 to 4 weeks. Savannah.
All right, John, thank you. And as we mentioned, vaccination clinics are filling up very fast since the supply is so limited. DeKalb County's appointments booked up quick, but they will reopen appointments Wednesday at 9 a.m. for a clinic on Friday. So mark your calendars there. And Fulton County is hosting a clinic tomorrow.